This week on Talk with Audrey, Dr. James Libecco, board-certified dermatologist, founding partner of Allied Dermatology and Skin Surgery, and former chief resident at the Cleveland Clinic, and Nitika Chopra, founder of Chronicon and a chronic illness advocate living with plaque psoriasis, join me today to talk about advocating for your health and why openly discussing your skin condition with your dermatologist matters. And part one of my three-part special series of interviews about sickle cell disease. Dr. Cheryl Mensah is assistant professor and co-chair of the Sickle Cell Research Workgroup and a hematology and oncology specialist at Northwell Zucker School of Medicine and attending at Phelps Memorial Hospital. We're going to talk today about advances in the treatment and care of sickle cell patients and ongoing research. It's all coming up this week on Talk with Audrey. Insightful, intelligent, and inspiring conversations and information to help you improve the quality of your life. It's all about the business of living. I'll be right back after the break. You're watching Talk with Audrey. Welcome back. Approximately 2 million Americans live with moderate to severe plaque psoriasis. It's a condition that causes dry, itchy, scaly patches or plaques to form across the skin. But psoriasis doesn't just affect the skin, it also starts within and can touch many aspects of a person's life, from dating and work to travel and fashion. Well, my guests today are Dr. James Libecco, board-certified dermatologist and the founding partner of Allied Dermatology and Skin Surgery, and former chief resident at the Cleveland Clinic, and Nitika Chopra, founder of Chronicon and a chronic illness advocate living with plaque psoriasis. They're going to talk with us today about advocating for your health and why openly discussing your skin condition with your dermatologist matters, and a new campaign. Welcome.
Thank you.
Thanks for having us.
Let me start with you, Dr. Libecco. Tell us more about plaque psoriasis and how it impacts people.
Well, chronic plaque psoriasis is an inflammatory condition driven by the immune system that results in red, scaly, itchy plaques, commonly involving the back of the scalp, the knees, the elbows, but really can involve any areas of the body that classically has an onset in the early adult years. And, really trying to increase people's awareness with this, that we're partnering with Bristol Myers Squibb and the So Have You Found It campaign to help, increase the treatment options and knowledge of this condition.
And what do people with plaque psoriasis notice first? And also tell us some of the signs and symptoms.
Yeah, they'll think they start with a bit of a rash. Classically, these red areas that it can really, like I said, be anywhere on the body, but especially dry elbows and knees that are really more than just dry skin. And it can really be impactful on their lives with the, discomfort that it can cause, the itching that it can cause, but also just the visibility of the condition, the fact that it's out there and presented in these commonly exposed areas that'll often force people to start to try to hide their condition. And we want to help them really reach out through the sohaveyoufoundit.com website and seek that therapy so that they don't have to hide behind that condition.
Nitika, you've been living with plaque psoriasis. What prompted you to become an advocate for your own health? And what advice do you have for others?
Yeah, well, I was diagnosed with psoriasis many years ago. And when I first got diagnosed, I felt so alone. I felt very confused. And as Dr. Libecco mentioned, it's a very visual condition. So I was very self-conscious, and all of those different aspects were really present in my journey with my plaque psoriasis. And I had to find my voice. I had to find the ways that I could be empowered and I could really show up to the doctor's office or show up in social situations with feeling that sense of empowerment. And that's why I've been so excited to partner with Bristol Myers Squibb and the So Have You Found It campaign. Even though I'm not on SOTYKTU specifically, it is just really about showing people that that sense of empowerment and owning your voice is possible.
So, Nitika, what advice would you give to people with plaque psoriasis about how to effectively advocate for themselves?
Yeah, that's such a good point, Audrey. It's really about, being prepared. I know for myself, I sometimes brought somebody with me to the doctor's office that I was close to. And I also wrote notes down and really tried to be prepared ahead of time so so that I felt that confidence as I walked into the doctor's office. As you mentioned, it can be a little intimidating. And if people want to go to sohaveyoufouндit.com, they'll also see a bunch of resources there. They'll hear other stories of people who are navigating plaque psoriasis, and it will really equip them with figuring out how they can walk into that next appointment and have maybe some of those scripts that are on the website and really utilize those resources.
Dr. Libecco, from a doctor's perspective, because I'm sure that from time to time you see patients struggling to advocate for themselves, what would you suggest patients do to get the treatment that they need?
Yeah, I mean, medical providers are here to help. And it sort of becomes human nature that people are embarrassed that there's anything wrong with them at all. They're afraid to bring up, issues that are bothering them about it, somehow that we might trivialize that or not be worried about it, especially, how it affects their day-to-day interactions when somebody has something like psoriasis, whether it's interworking with coworkers or out at the gym or afraid to go to the pool because of the visibility of the condition, or even issues like intimacy with it. They're very embarrassed to bring up. But in the end, we're here to help, and I can only help if you let me know what parts really bother you.
And doctors are only human, and you're not a mind reader. So yeah, I would encourage people watching, if you have an issue, don't be afraid to mention it to your healthcare provider. So doctor, talk to us about treatment options.
Yeah, so it's really been an evolution over the last 20 years or so of psoriasis therapies, from lights and creams that people have to apply across their skin to injectable medications into oral medications like Sotyktu or deucravacitinib, a once daily pill that you can take to treat moderate and severe chronic plaque psoriasis, showing improvement in their skin, tempered with the risk of cough, cold, or upper respiratory tract infections or acne-like eruptions on the skin.
All right, so there are options out there, but again, you have to speak up. You have to advocate for yourself. Where can we go to learn more about the campaign?
You can go to sohaveyoufouндit.com.
All right, the website is sohaveyoufouндit.com. I want to thank Dr. James Libecco and Nitika Chopra for joining me.
Thank you.
Thank you.
I'm going to take a quick break, and I'll be right back. I'd like to invite you to follow Talk with Audrey on Twitter and on Facebook. Simply visit talkwithaudrey.com, where you can also sign up for my free weekly newsletter and for access to exclusive web content and information about upcoming shows. Visit talkwithaudrey.com. You're watching Talk with Audrey. Welcome back. Manhattan's Community 9's chair of the Health and Environment Committee, Laquita Henry, reached out to me to help them raise awareness, dispel myths, and foster a supportive community for those affected by sickle cell disease. The Health and Environment Committee plays a vital role in monitoring and addressing the social determinants of health within the community, and they also nurture a healthier, more sustainable West Harlem. As a resident of New York City and the community of Harlem, coupled with my commitment to provide information every week to help people improve the quality of their life, well, you know me, I had to dive in. And I'd like to thank her and the chairman of the Community Board 9, Victor Edwards, and District Manager Yutha Prince for working with me to present a series of interviews with doctors and a survivor of sickle cell disease. You're going to meet Dr. Cheryl Mensah, Assistant Professor and Co-Chair of the Sickle Cell Research Workgroup and a Hematology and Oncology Specialist at Northwell Hofstra Zucker School of Medicine and attending at Phelps Memorial Hospital. You'll meet Dr. Susanna Curtis, Assistant Professor of Medicine at the Icahn School of Medicine and Assistant Director of the Adult Sickle Cell Program at Mount Sinai Hospital. And sickle cell patient Montez Davidson and her daughter Kasara shared their journey. Did you know that according to the National Institute of Health's National Heart, Lung, and Blood Institute, sickle cell disease is the most common form of inherited blood disorder and affects more than 100,000 people in the U.S. and 20 million people worldwide? Joining me now, my first guest, Dr. Cheryl Mensah, Assistant Professor and Co-Chair of the Sickle Cell Research Workgroup and a Hematology and Oncology Specialist at Northwell Hofstra Zucker School of Medicine and attending at Phelps Memorial Hospital. Welcome. Dr. Mensah, who's at risk and what are some of the signs and symptoms of sickle cell?
So sickle cell disease is a blood disorder that affects the red blood cell. In sickle cell, it causes the red blood cells to change shape, to block the blood vessels and prevent oxygen from being delivered. And this can cause some patients to have symptoms such as pain. The most common or the hallmark of sickle cell disease is having a pain crisis that can cause patients to go to the ER or to the hospital. The people who are at risk for sickle cell disease, it can affect people of all backgrounds, but it's most common in people of African descent. Sickle cell disease is actually most common in people from West Africa, but can affect people from the Caribbean and African Americans. It can also affect patients who are Hispanic and Caucasians more rarely, but still can be affected by sickle cell disease.
And so it's not a very common trait, but everyone seems to think that it's just African Americans who are impacted. And what I've just heard you say is that that isn't the case at all.
Originally, in people with West African descent, there was sickle cell as an evolutionary condition to help protect people from malaria. And so it affected people mostly in areas where malaria was prevalent, like in Africa. However, as centuries have gone by, as people have migrated from continents and intermarriage and other things of life, we see sickle cell disease in people of Hispanic descent, people of Caucasian descent, especially Italians, like Southern Italian. And even in the Middle East, in India, there's sickle cell there also. So anybody can get sickle cell disease. It's just a matter of, who your parents and grandparents and descendants are. But it can affect anyone.
And are there variations of sickle cell disease?
The most common is we call it hemoglobin SS. And so, within our red blood cells, we have hemoglobin. That's what carries oxygen. And regular hemoglobin is called hemoglobin A. Sickle cell hemoglobin is called hemoglobin S. Patients with SS disease, about more than 90% of their blood is sickled hemoglobin. So these are cells that change shape and don't deliver oxygen as well as they should. But there are other types that are more milder, such as sickle thalassemia, sickle beta thalassemia. Thalassemia is another blood disorder that affects people, actually more commonly people of Mediterranean descent, like Italian and Greek, but also African American. And sickle beta thalassemia can be a milder version of sickle cell disease. Same with hemoglobin SC disease. C is another type of hemoglobin. And so there's SS, which is the most severe. There's sickle beta thalassemia, hemoglobin SC, and those are the three most common types. But there are a lot of other types, even beyond those three. There's a whole category of blood disorders called hemoglobinopathies. And these are basically where you have different types of hemoglobin, but any of those paired with hemoglobin S can also cause sickle cell disease.
Well, Dr. Mensah, how is sickle cell diagnosed?
Sickle cell disease is diagnosed at birth. So when a baby is born, they do a heel stick and they send off the blood to the lab and they look for sickle cells within the blood. For parents who have a baby with sickle cell disease, they will usually receive a letter from the hospital saying that the baby has a red blood cell disorder. Then they will send a letter to the hematology office that is affiliated with that hospital for a first-time appointment with the parents and the baby and the hematologist. For people who are born outside of New York or outside the United States, if they're adults, they do another test called hemoglobin electrophoresis. In this test, they look for sickle cells in the blood. If you have over 50% of the blood with sickle red blood cells, that is sickle cell disease. If you have less than 50%, that is sickle cell trait.
What complications might someone with sickle cell experience?
So sickle cell disease can affect every organ. The most common complication is a pain crisis. And that's when the sickle cells block the blood vessels, and that blockage causes a lack of oxygen to be delivered, and that can cause pain to the patient. So that can affect them in their joints. They can have, hip pain, shoulder pain. It can affect their lungs. It can cause a condition called acute chest syndrome, which causes the patient to be hospitalized, have difficulty breathing, and require antibiotics, fluids, and even a blood transfusion. It can cause patients to have a stroke. Patients could have strokes with sickle cell disease, and a stroke in sickle cell does not present in the same way as a stroke with a patient, with high blood pressure, for example, because sickle cell affects patients who are younger, so they have different manifestations. Sickle cell can also affect the eyes and cause vision changes. It can affect the kidney and cause kidney disease, and so there are almost every organ can be affected by sickle cell disease, and patients can have complications anywhere, head to toe, from sickle cell disease.
So I understand that one of the complications is a pain crisis.
A pain crisis is when, during times of stress, the red blood cells change shape and they block the blood vessels. By blocking the blood vessels in the body, it causes a lack of oxygen to be delivered, and the patients will experience pain. This can be triggered by a number of factors, sometimes cold weather, lack of sleep, any condition that can cause any disturbance to the patient can lead to a pain crisis. Most patients try to treat their pain crises at home. They use fluids, they take their medications, but some patients, they're not able to completely manage it at home. So they go to the emergency room. In the ER, they treat patients with fluids and pain medication. The biggest advice I can give to patients for when they go to the ER is to bring their medications with them, bring a letter from their doctor stating their diagnosis, stating what they normally take and what normally works for them in the ER, and also just to have an advocate with them to stay as calm as possible so that they can have the smoothest ER experience as they can.
Dr. Mensah, what treatment options are currently available?
We call them disease-modifying medications. The first one is hydroxyurea. Hydroxyurea is a medication that was FDA approved in the 90s. Hydroxyurea helps increase the amount of fetal or infant red blood cells in the circulation. These are red blood cells that contain a hemoglobin called fetal hemoglobin. These red cells, they stay round, they don't sickle, and they are able to deliver oxygen more effectively than the sickled red blood cells. So patients on hydroxyurea helps raise the number of these fetal hemoglobin red blood cells. And by doing that, there's less sickled red blood cells in the circulation. And so patients have less pain crises, less ER visits, and less hospitalizations. The other medication is L-glutamine, which came in 2017. L-glutamine is a protein powder that's mixed with liquid. And by taking L-glutamine, usually in combination with hydroxyurea, it can also help decrease pain crises, hospitalizations, and ER visits. L-glutamine is also called Endori. That's the trade name for L-glutamine. L-glutamine is an amino acid or protein. The third medication is Oxbryta. Oxbryta is a hemoglobin modifier. And so within the red blood cell is the molecule called hemoglobin, and that's where oxygen sticks to. During a sickle cell crisis, the red blood cells, they change shape. And so Oxbryta, which is also called voxelotor, it sticks to the hemoglobin molecule and it stabilizes it. It prevents the red cell from sickling. By doing this, the red cells stay round and able to deliver oxygen better to the organs. Oxbryta was FDA approved to help improve anemia and reduce blood transfusions in sickle cell disease patients. And the last drug that was FDA approved is called Adakveo or crizanlizumab. This is an antibody against a molecule called P-selectin. P-selectins are molecules that help red cells stick to each other, stick to white blood cells, stick to the blood vessel wall. During a crisis, the red cells, they change shape, but then they stick to each other. And by sticking to each other and sticking to the blood vessel, they help block the blood vessel and prevent oxygen delivery. What Adakveo does, or crizanlizumab, it blocks those molecules so the red cells are able to move past each other and deliver oxygen more effectively to the organs. Adakveo was FDA approved because it was shown to reduce pain crisis, ER visits, and hospitalizations in sickle cell disease patients.
What about resources? Are there patient advocates or sickle cell organizations that people can go to for more information?
There are plenty of resources for patients and families to learn more about sickle cell disease. There is the Sickle Cell Thalassemia Patient Network. This is a local New York-based organization, and it has a lot of resources on sickle cell disease, sickle cell trait, and how to stay healthy and well. That is part of a larger organization, the Sickle Cell Disease Association of America. And this is a national organization that has many resources and videos about sickle cell disease and how to stay well. There's also the American Society of Hematology that has a large number of patient and provider resources. Almost every clinical trial for sickle cell disease gets published within the American Society of Hematology. And so that is a great resource. Also the Center for Disease Control, the CDC, they have a lot of resources on sickle cell disease. And I want to point out to the American Society of Hematology, they have meetings that are open, and anybody, even a patient, a parent, anyone can attend these meetings to learn more about sickle cell disease.
And Dr. Mensah, what advice would you give to someone who's recently been diagnosed with sickle cell?
So the best advice I would give, I can give two pieces of advice. The number one advice I would say would be finding ways to de-stress and cope when you have times of stress. I think the biggest thing that I see with patients is when they're in a stressful situation, many patients, that stress can cause them to have a pain crisis and feel unwell. So finding ways to manage your stress and to withdraw in any way you can, whether it's, when you get angry or something occurs, to withdraw yourself from that situation, to getting rest, drinking water, limiting, turning off the music, staying in a quiet room, doing anything you can to de-stress. That would be my number one advice to patients. The second thing I would say is to see a doctor regularly and have a plan, an ER plan with your doctor. You need to have a doctor who knows you and knows you well, and knows you not just in times of crisis like in the ER, but knows you at all times. When a doctor sees you when you're not in crisis and when you're in crisis, they appreciate it more, and they have a better understanding of how it's affecting you and how it's affecting your life. And I can give one more piece of advice to patients, is to be as descriptive as you can about your pain and what you're going through. The more articulate you are, the more the doctors can have an understanding of how it's affecting you. Unfortunately, pain is something that can't be measured. There's no lab test. There's no exam finding that really tells the doctor, oh, this person is going through a pain crisis. And so the doctors rely a lot on the communication that they get from the patient. So the more you can tell any doctor that you see and be as descriptive as possible, with as much information as possible about your medications and what you're going through, what you're dealing with, that will help the physicians take better care of you.
Great words of advice. Check out those websites. Thank you so very much, Dr. Mensah, for joining me and for this incredible information.
Thank you.
Be sure to join me next week for part 2 of my series on sickle cell disease. I'll speak with Dr. Susanna Curtis, Assistant Professor of Medicine at the Icahn School of Medicine at Mount Sinai and Assistant Director of the Adult Program for Sickle Cell. We are going to talk about new medications, treatments, and ongoing research. Well, that's it for this week's show. I'm Audrey Adams. Join me here next week for more insightful, intelligent, and inspiring conversations and information to help you improve the quality of your life. It's all about the business of living. I'll see you next week.